Hi, Dr. Ron. Dr. Ron Loswitz, Injury Recovery Centers. Whiplash or cervical sprain. We get this a lot. So whiplash is the mechanism, which means the way the head moves. And cervical, this is cervical spine, sprain. What we're looking at essentially is the sprain of these joints and all other bad things that could go along with it, including disc herniations, including muscle tears and ligaments stretching. So whiplash injury is layered. Once again, we're dealing with the muscles, we're dealing with the joints, the cartilage of the joints, we're dealing with the ligaments of the joints, and dealing with discs. Now, the important thing is that these all have different healing times. That's what's very important with whiplash treatment. So the best treatment for whiplash is one, to make sure you get treated sooner than later so we can identify the severity of things, because the muscles are going to be the first to heal. Those are awesome to heal. Then you may be left over with a possible disc herniation that can remain for a very, very long time, irritation to the joints. So the very first thing is you want to reduce the muscle tension, because if muscles are tight because they did their job, what they're simply doing is remaining tight, which is compacting an injured area. If you compact an injured area, the joints will remain inflamed, you have stiffness, lack of range of motion. If there's a disc injury with the muscle still tight, all it's doing is squeezing that disc even harder. So we want to eliminate that from the get-go. After that, we start restoring ranges of motion. My office, we use chiropractic therapies with different therapeutic modalities, such as exercises, stretching, things of that such, which start getting some better movement in there. So as far as an overall best treatment, it's going to depend on your severity, but it's also going to depend on how much you want to get better, because when patients come in, 1 or 2 visits does not cut it, because inflammation is going to remain. If inflammation remains, the joints are going to basically lock down. Essentially, you lose range of motion. Osteoarthritis sets in for the long term. So best treatment is for you as a patient to make sure you want to get better, and we do our due diligence together to make sure that we let this go away and you get the best outcome as possible.